Hi, good afternoon. Thank you all. Thank you, Des Moines University and Kelvin Communities for inviting Dr. Bender and me to talk about this very important topic of healthy aging and brain wellness. So just so you're not confused about who's who, the person on the right that's me, Dr. Shah. Dr. Bender does like to pretend as me once in a while, but to be very clear, we are friends, we have common goals, but we are totally distinct two people. Those of you, if you have not been to Broadlawns, please do visit us. It's a nice new campus. In last 8 to 10 years, we have made a lot of good changes. So in next 45 minutes, Dr. Bender and I'll talk about 3 important areas. I will talk about the difference between healthy aging and dementia. I'll also talk about the stage before dementia called mild cognitive impairment, and Dr. Bender will talk about what can we do now, all of us in this audience and people listening on the phone, what can we do at irrespective of our age, whether we are 20, 40, 60 or 80, what can we do to keep our brain healthy for our memory? So that's our goal. You'll have plenty of time to ask questions at the end. If you don't, we'll give you our number so you can call. So as you know, we all forget something. But the question becomes, what do we forget, and how much do we forget? How frequently do we forget? And then important thing is, how does that forgetfulness affect our day-to-day life? How does my forgetfulness affect my independence? And that's the important part. So let me start with this continuum, cognitive continuum. Like all chronic conditions, dementia included, dementia, heart failure, COPD, and others, like all chronic conditions, by the time we see that disease, in our case, dementia, the disease process has been going on in our brain for a long time. In case of dementia, depending on the type, it might be going on for 10 to 15 years. Yes, 10 to 15 years. So let me start with what's normal. So as we talked, some of us, we see that we have normal cognition, but we all forget something, and that forgetful can be benign. Like I might forget name of my medical students who rotate with me, and if I don't get to see them for a long time. So that's normal. But for me, to forget my mother-in-law's name is not normal. Same thing, many of us who are new to Des Moines University, when we go out of this parking lot, from here to the parking lot, we'll have to look left and right and see where is my car parked. And that's normal. What is not normal is to not remember that I brought my car here and then call Uber or call a taxi to go home. So that's not normal. In between normal age-related cognitive decline, ARCD, and dementia, there is a stage relatively new called mild cognitive impairment. And that is the stage we'll be talking about today. So what is mild cognitive impairment? Mild cognitive impairment, those who are medical students in this audience, according to DSM-5, it's the modest degree of cognitive decline, which is not sufficient. The patient is still able to keep their independence. So it's a cognitive decline without losing the person's independence. We use many different tools. One of these tools is Montreal Cognitive Test, MOCA it's called, to check for the mild cognitive impairment, MCI. So why do we worry about diagnosing MCI? Multiple reasons. It's very common. A lot of people currently in US, there are about 7 million Americans who might have mild cognitive impairment. And as we age, at the age of 60, it's about 6%. At age of 85, there is a potential to have 1/3 of people at age of 85 might have some form of mild cognitive impairment or MCI, pre-dementia. Why do we worry about it? The good news is, and that's what Dr. Bender will talk about, that up to 40%, 15 to 40% of people with mild cognitive impairment, MCI, can revert to normal through significant lifestyle modifications. So almost 40%, 1 in 3 of MCI can be reversed, or we can try to hold it. What's the bad news? If we don't do anything about it, if we don't change our lifestyle, then there's a 12% chance every year that this MCI can go into dementia phase. So 12% chance if we don't do anything. And of course, some of people might enjoy the benefits of having dementia. There might be, there are some benefits of dementia, which is either people, as it says on the screen, don't have to rerun that, watch the TV or meet the new people. You can hide your own Easter eggs or other things. So that's the importance of diagnosing mild cognitive impairment, and then importantly doing something about it, which you'll hear from Dr. Bender. So why worry about it? Because what have we found, that there are ways we can keep our wellness, and dementia is not a normal part of aging. A lot of science has been done and a lot of articles have been written on this topic of how do we keep our brain healthy. I'll talk about relationship with chronic conditions and dementia. A great article just came out in Lancet in December issue. And then Dr. Bender will talk about different lifestyles and why does it work. So what does the article in Lancet say? It talks about that 1 in 3, 35% of all dementias can be prevented by addressing these 9 conditions. So what are the 9 conditions? The 9 conditions are as mentioned over here. The hearing loss is a significant condition, failing to complete secondary education being a huge one, smoking cessation, and depression, physical activity. Dr. Bender will focus and talk about social isolation, and then chronic conditions like blood pressure, obesity, and diabetes. So with this, I'll give you the website and our number to call in case if you have more information, and I'll introduce my good friend and partner, Dr. Bender, to talk about what can we do now to have brain wellness. Thank you.
Hello, my name is Dr. Bob Bender. I'm a geriatrician here in Des Moines. I work at Broadlawns Medical Center. Dr. Shah and I have been collaborating for a number of years regarding neuroplasticity, or the ability to change one's brain. We've been studying this for quite a while, as I say, and what we've learned is that the brain is much more plastic than anyone had ever really imagined. So we can, to some degree, take our brain health into our own hands and optimize it. We're learning more and more about this, and of course, science is accelerating in this day and age of the computer, so we're hopeful that these ideas can have both a preventive and an interventional impact on the changes in the brain that come with just aging, but also diseases like Alzheimer's disease. There are several tenets when we talk about healthy brain aging, and I'll go through those for you. First, I'm very grateful to Calvin Community, Des Moines University, and the Alzheimer's Association for bringing us together to discuss this. It's always very enjoyable to talk to groups that represent multiple disciplines and traditions. The number one key to healthy aging is socialization. We all need to be connected. And of course, there are different levels of socialization. Superficially, we run into people all the time. but we're still connected. So those episodes where you go into the store and buy some groceries and see the checkout kids, or just go into one of the quick trips and fill up with gas. We don't pay too much attention to these, but they are important. If one is ever isolated and one doesn't experience these relatively superficial interactions, we miss them. So it is important just to get out there and about and interact. The next level of socialization is that level which involves coming together with other people for a common cause, like being in a certain faith community or a book club or an exercise group. Anything that brings people together for common cause is very, very good for our brains. The next level is that level of intimate socialization, where we are in a group where we accept others unconditionally and where we can feel unconditionally accepted. This seems to be the most dramatic level of socialization in terms of impact on our brain. When we have friends that really know us and accept us despite our many weaknesses and individual idiosyncrasies, the brain finds a place, a group where it can go and just be oneself. This lowers stress, increases alertness, communication abilities, so it's very, very important. The next tenet of healthy aging and brain wellness is exercise. Good, regular physical exercise is of paramount importance. We want to do some aerobics where we put the body through regular movements like walking or jogging, swimming, dancing, something like this. And we also want to do stretching, regular flexibility exercises. Next, we also want to have some muscle strengthening involved. So weightlifting or using bands, things like this are very important to put our muscles through range of motion against resistance. Next, we want to do balance training. We want to put our bodies through different positions in space. Next, we want to do what we refer to as skill acquisition, where we actually learn new things while we're exercising. The next key to healthy aging and brain wellness is to study, to learn new things. We all get new brain cells every day, contrary to the old tradition, which says the brain doesn't make new brain cells. We do, but these new brain cells really only become truly functional if we are regularly studying and also exercising. So we want to combine these two things. Next, we want to lower stress. We really want to pay attention to those things that lead us to be stressful and either get rid of the stressor or change how we react to the stressor. Both can be difficult, but deserve good, regular attention. Next, we want to have a good healthcare system, a system that is accessible to us, ideally through one number, so that we call that number, we get some advice, we know where to go, we have both primary care services available to us and specialty services. Very important. Next, we want to try to abide by the admonition to avoid anything in excess. There are three areas where Americans and other people that live in an industrial society are at risk for major side effects. Tobacco, there's really no healthy use of tobacco, so any use is felt to be excessive. Next, alcohol. More than one drink a day for women or more than 2 drinks a day for men is felt to be excessive. And as we get older, we probably metabolize alcohol less efficiently. So we really want to try to minimize alcohol. It can be very addictive. And it's important to note that perhaps as much as 1 out of 10 people at or over the age of 65 here in America have or have had a problem with alcohol. So it is something that we need to be very mindful of. Next, calories. We're lucky in our culture to have access to good nutrition for most of us, and trying to control our calories can be difficult. The things that taste so good are often loaded with sugar and fat, so we have to be very careful. Combining a well-rounded diet with good exercise can help us maintain a normal weight, and this is very important. There is some strong evidence that a Mediterranean type diet with lots of fruits, vegetables, fiber, and fish may actually be very healthy for our brains. The science around this tenet, that is the Mediterranean diet, is getting stronger and stronger, so we do routinely advise it. Next, we want to try our best to take 1 day a week and rest. This is an admonition that seems to be recommended throughout the world's great religious and wisdom traditions. Interestingly enough, one demographic in America, the Seventh-day Adventists, have the highest percentage of people living very well to great ages. And when they are interviewed, they very frequently point to their great dedication to taking a day off a week and resting and giving it to their religious tradition. Our team recommends this routinely, and I think it's something to pay attention to. Next, we want to practice brain wellness. We want to regularly attend to our brain with the above mentioned ideas, but also we want to pick things to really try to learn and incorporate an effort to memorize. We know that we can actually grow our memory centers in our brains, and this is best stimulated by an effort to learn new things and memorize. We also want to emphasize good sleep. The brain needs good, refreshing sleep for it to function optimally. So if you have trouble sleeping, get together with your doctor, look for the many potential causes, and then take steps to ensure a regular good night's sleep. The next tenet is to pay attention to one's spiritual life. There's a lot of research to suggest that people who are involved with a faith community live longer and maintain healthier brains. So how does one attend to this? Well, there are some global recommendations that perhaps would apply to the vast majority of us. Number one is to read the scriptures that are a part of one's own spiritual tradition. Next is to reflect on what we've read or heard. Next is to respond to what we've read or heard, perhaps with prayer. Finally, we want to recommend meditation. Regular meditation seems to enhance brain wellness through a cascade of very interesting and exciting effects in the brain that have been well documented thanks to a relatively new specialty around the world called neurotheology. That is the effect of spiritual activity on the brain. Our spiritual activity should include regular, quiet times of meditation. Our team recommends centering prayer, which is 20 minutes in the morning, 20 minutes in the evening, picking a prayer word, if you will, letting it draw you to your center, and then just resting there with God. For those people and traditions that do not have a God-centered tradition, we recommend picking a word that represents compassion or patience or truth, and letting that word draw to your center, and then just rest there for 20 minutes in the morning and 20 minutes in the evening. A wonderful physician named Andrew Newberg has done serial brain scans on people that practice this sort of activity, and the changes are predictable and very exciting. So we recommend it highly. So hopefully those keys to healthy aging and brain wellness will be somewhat helpful. We recommend them to you highly. And hopefully we can put on more of these conferences to bring newer information to you. I'm very grateful to have been here, to DMU, Calvin Community, my colleague Dr. Shaw, and everybody involved. Thank you very much.